like to welcome everybody to the Second Tuesday Forum. It's noon, and we do try to start our program on time. I'm Sue Burton, co-chair of Second Tuesday Forum, and Ms. Mary Hodges over there can't hear me. She's the other co-chair. Before we start the program and I introduce the speakers, I would like to introduce the new president of the Friends of the Library, Mrs. Glenn Tinsley. If she would please come up and say a few words about the Friends.
Thank you, Steve. Good afternoon, welcome, thank you for coming. I'm kind of naturally loud.
Well, you're tall.
Tall. I hope everybody stayed warm on the way in here. It was kind of brutal weather this morning. We have some materials on the back table. I see so many of you are already friends of the library, and we really appreciate that, and we love to see you. So for those that are not or just want to see what's the latest handout, we have them on the table at the far back. So that, and if you have any questions, I'll be here. Please feel free to come and find me. And we're really excited about today's presentation on Medicare. And these two wonderful people are going to tell us everything we always wanted to know and some of the extra things. So thank you, Steve. Appreciate it.
Thank you, Glenn. And because she's new to this, she forgot that they pay for this particular program in January, because we do pay for the loan of the Commodore, and we pay a little bit to our speakers. So thank you, Friends, very much. So I have been corresponding probably, as we said, about 9 months with Ms. Bernita Linder. She is the Benefits Counselor Supervisor in the Center for Aging, Senior Services of Southeastern Virginia, SSEVA. I told her I would expand on her biography because she's one of those people that obviously doesn't like to brag on herself, as they say. But she moved to Virginia last year, or 2013, from Westchester, New York. And she was a supervisor for the Department of Health and Human Services for 18 years there. She obtained her Bachelor of Arts in Criminal Justice and a Bachelor of Science in Social Work from Elizabeth City State University. And she says she is the proud mother of Melvin Jr., who is age 5. And she's going to come up, but then she is going to introduce one of her co-workers who is responsible for the city of Portsmouth. Her name is Margie Ferguson. So I will turn it over to you, Bernita and Margie. Thank you.
Good afternoon. It's indeed a pleasure to be here, and I'm on behalf of Senior Services of Southeastern Virginia. We would like to say thank you for inviting us here. We've been planning this probably since July, I think. Sue's the only person that she knows how to track me down, whether it was my work email or my personal email. We were able to email each other. Senior Services, we're actually going into our 41st year this year. We offer a lot of services from transportation, Meal on Wheels, senior companionship. I have the pleasure of being the supervisor for the Benefits Counseling Department, where we actually cover Western Tidewater as well as Norfolk, Chesapeake, Virginia Beach. Margie Ferguson, I've had the pleasure of working with Margie about 2 years now. Margie actually is the face for Portsmouth and Virginia Beach. Margie has been in the field quite a few years. She loves it. Her energy is out the door. And she has a way of actually helping and making the person feel really secure with making decisions. So without any further ado, it is my pleasure to introduce Margie Ferguson, our Certified Medicare Benefits Counselor.
Hello.
Hello, good afternoon. Margie Ferguson. As Bernita said, I am the certified Medicare benefits counselor for Portsmouth and Virginia Beach. Before I get started on Medicare, I would like to say that with Senior Services of Southeastern Virginia, we are a nonprofit, which means that I am there as a guide for you all, for anything Medicare. And we're going to go into all the different parts of Medicare. But I am not an insurance agent. I am, as we said, certified, so I work on your behalf to help you make the decisions for the consumer, because everybody is different with their situation, with the medicines that they take and their needs for the insurance and the medical field. So I just want you to know that I'm not here to sell anything. I am only here as a guide or a liaison, I can also be an advocate for any claims issues, any questions you may have, any concerns. So please feel free to contact me after the meeting today if you would like some one-on-one counseling. We can make appointments. I can come out to this side over here in Portsmouth. We're going to start trying to be out here once, a lot during the month. So otherwise you can call me, email me, whatever's most comfortable for you all. So I just wanted to put that out there that I really enjoy this job. I love helping people, and the fact that I'm not selling anything makes it even better, because then at the end we can all just shake hands and go our way. So with that said, we're going to start the presentation on Medicare. I'm going to be, first of all, let me ask you, who here already has Medicare? Can I just see with a show of hands? Okay. So I'm going to review so that everybody's on the same page, and then we'll take it a step further from there, okay? Okay, so Medicare, I'm going to go over the introduction to Medicare, the original Medicare plan, the Medicare supplement insurance, or they're also called Medicaps, the Part C, which is the Medicare Advantage plans. I'm going to review Part D, the prescription drug plans, and I'm briefly going to review the topic of Medicaid and the Medicare savings programs. We are going to ask, I think that afterwards, if everybody would just keep their questions till the very end. Oh, okay. Sorry. Okay, so applying for Medicare, since we all have Medicare already, I'm not going to really go much into that. But usually it is when everyone gets Medicare when you're 65 years old. You can apply 3 months prior to the month of your birthday. You can also the month of your birthday and the 3 months after your birthday. When I say apply, you are actually notifying the Social Security Administration that you would like to participate in the Medicare. So that's what's called the initial enrollment period. But if you are on Social Security disability insurance, if you are disabled and you're under the age of 65, when you are entitled to Medicare, you will automatically be sent a card, and that's 24 months after you've been getting your Social Security disability insurance checks. So here's a copy of the Medicare card. We all know and love these wonderful red, white, and blue cards. Yes, you can laminate them and put them in your wallet. Please don't ever get rid of these. It is your identifier for when you call Medicare or if you contact us for any assistance. We have to have your Medicare claim number and the effective date for Parts A and B. That's how we use you. Those dates are specific to you, and that's how we identify you. Okay, so Medicare. The basics, just the basic of Medicare. Part A, that's the hospital insurance, okay? Part A, think of hospital, A for admitted to the hospital. If you remember, Part A is hospital. Part B is the medical insurance. Anything not associated with the hospital, which would be the doctors, the outpatient, the durable medical equipment, or the preventative, all that's under the Part B, and I'll go into that shortly. And then Part D for drugs. Just remember D for drugs. So let's review. Part A is the coverage you get when you are admitted inpatient. And I think recently we've heard some things on the Nightline and some of the national news about people having problems with their Medicare because they weren't actually admitted inpatient. So they weren't being covered under the Part A. But you would have coverage under Part B if you're if you happen to go to the ER but you're not admitted. Okay, so you would still have the coverage. Okay. Part A is the hospice care comes under Part A. The home health care comes under Part A. And Part B is the doctor services, the outpatient care, preventative services, the diagnostic tests, the MRIs, the CAT scans, some therapies, and the durable medical equipment. DMEs is what we call them anytime you may need oxygen or any, oxygen, what else is there? Hospital beds, yeah, there. And then the Part D is the outpatient prescription drugs. I did go over, I'm sorry, I skipped Part A. The skilled nursing care is also under Part A. That means that, for instance, you have a surgery and the doctor says you need to go to the rehab center. Part A covers the rehab up to 20 days, okay? And after 20 days, you would have a copay, but the first 20 days, they feel is sufficient, and after that, they try to boot you out anyways. Okay, so Part A, usually everybody gets this. We refer to it as a premium-free Part A, because if you have paid into the Social Security system and the Medicare system, you've earned Part A, so you don't pay for it every month. Part B, I already went over the initial enrollment period, which is when you first turn 65. The general enrollment period is right now, it's January 1st through March 31st of every year. This is general, but this would pertain to those that already have Medicare and wish to make a change and go back to original Medicare, or those that just haven't taken their Part B and have no other coverage. Don't be confused with the general enrollment period to what's called the open enrollment period. We've all heard about open enrollment. We just finished open enrollment. Hopefully everyone knows October 15th through December 7th is your time to review your Medicare coverage. We're here, that's our busy time, but call us anytime, we'll get back to you. At that time, you get to review your plans, which means that do you have to make any changes? Absolutely not. But you get to review it. You get to review your plans, is how I like to explain it. Every year, things change, your medicines, your situations may change, so Medicare allows for that during open enrollment period. So remember, Thanksgiving, if you haven't contacted us by Thanksgiving, to review your plan just to see even if you're happy, we say, please just call us, let us tell you what the potential expectations could be for the following year, okay? So, Part B is the medical portion. Now, some people, not everyone takes Part B when they turn 65. Why is that? Because if you are working still, or your spouse is still working, and you have coverage through an employer, either through yourself or your spouse, you do not need to take Part B, okay? So what would you do? You would, when that card comes to you, it says, if you do not want Part B, send it back. you would send it back and they would ask you, do you have other coverage? And then yes, you would tell them, yes, you are, you have other coverage, and there is no penalty. If you have other coverage when you're 65 and don't take Part B, as long as you let them know when you're ready for Part B, when you lose that other coverage, you just let them know, hey, I've had other coverage, they will not penalize you, okay? Because there's a lot of people say, well, am I going to get penalized? As long as you can show that you had other coverage, there is no penalty. So this is an example of the enrollment period. Marie turned 65 on June 25th of 2013. She will have group health coverage from her employer until she stops working on December 15th of 2013. So the Part B enrollment would look like this. Her initial enrollment period when she first turned 65 would be in March of 2013, and that would go until September of 2013. That's the 7 months I talked about. Now, her special enrollment period, because she is still working, she has from September of 2012 until March of 2013 to sign up for Part B and make any enrollment changes if she would like then. And the general enrollment period is January 1 through March 31st. Okay, so I covered Part A. Part A, as I said, is usually no charge for the premium. Part B, everyone pays $104.90. Everyone pays that, okay? If you have TRICARE for life, you're still paying the $104.90 for medical for Part B. If you have federal employment health benefits and you still use Medicare, you would pay the $104.90. If you're not taking your Social Security check, they will bill you every 3 months. Okay. So the Part B premium, as we all know, depending on how much you make, 2 years in arrears, the Medicare says if you've made more and you are single, if you've made more than $85,000, we think we should charge you more for Part B. And so it's called income adjustment for Part B. And so if you made more 2 years ago, depending on what you claimed on your adjusted gross income for the IRS, they would let you know if you have more of a payment for Part B. So the Medicare choices: original Medicare, Medicare Advantage plans. There are some other Medicare plans which we'll review, and then the Medicare prescription drug plans. The original Medicare, if you are using original Medicare, you're using your red, white, and blue card, okay? That gives you the liberty to go to any doctor across the United States as long as they accept the Medicare assignment. You do not have to worry about referrals. You don't have to worry about any authorizations. As long as they have accepted the Medicare payment, it's good anywhere across the U.S. Okay, so Part A. We're going to start with Part A. Hospital. In 2015, if you have original Medicare and original Medicare only, for instance, there is a deductible that's attached to the Part A, okay? So if you are hospitalized inpatient for days 1 through up to 60 days, you will be liable for the $1,200 deductible. It's actually $1,216 deductible first, okay? After that, if you are still in the hospital for days 61 through 90, they have a co-payment each day of $304, okay? After days 90, each day is then at $608, okay? With Part A, as I mentioned, the skilled nursing facility, as I said, if you need to go in rehab, days 0 through 20 are free. After day 20, you will have a copay of $152 per day for days 21 through 100. Part A also covers home health care, in which you would pay $0 as long as it's, in other words, as long as you have a prescription for home health care from your doctor and you use a Medicare provider, you would have, you pay $0, but you would pay 20% of any equipment that they may need. Okay. Part B, medical, also has a deductible. Every year, it's $147. Okay, pretty much everyone meets that the first time they go to the doctor, and for each year. After you meet your deductible, you will be liable for the 20% of the Medicare approved amount. So here's how I give an example. You go to the doctor for the first time in January. The doctor sends a bill to Medicare, and it may be $1,000. The Medicare approved amount is then what we look at. The Medicare approved amount is substantially lower than the charges that are actually being charged. So it may say charges $1,000, Medicare approved amount may be $600. So you would be liable for the 20% of the Medicare approved amount. It's not the full amount. When we say 20%, people kind of, but it is of the approved amount. So we have a little bit of cushion there because it is not the full cost, which you would be liable for. Okay. Now, original Medicare Part A and B is wonderful. It's good coverage. But that 20% scares everyone. Why? Because there's no point at which Medicare says, you know what, you have paid a certain amount, we're going to take over 100% from here. There is no ceiling for out-of-pocket spending for every year. So, what is your alternative? So that's why we look at the Medigap policies or Medicare supplement. These Medigap policies are private insurance policies that you take out. It covers the gaps of Part A and B, those deductibles and the co-insurance that I referred to. If you get a Medigap policy, you're going to pay every month for this policy to know that it is going to fill in the Part A and the B gaps as you need it. Now, remember, these Medicare supplements are gaps. They are standardized according to what they cover. When you think of a Medicare gap, a Medigap or supplement, think of your home insurance or your car insurance. This is something you're gonna approve to pay every month, regardless if you use it or not. Is it expensive? It can be. Again, just like any other car insurance or homeowner's insurance, it depends on what is covered as to what your premium is going to be. Now, I said there are 10 standardized policies. They go by, they're called plans, Plan A all the way through N. If you came to me and said, Margie, what's the Cadillac of all the plans? A Plan F, F as in Frank, is the most inclusive plan for the Medigap policies, okay? A standard 65-year-old Medigap policy averages about $130 a month. Now remember, this is in addition to the $104 that you're already paying for Part B. So it's $104.90 plus the amount for the premium of the Medigap, which would be average, as I said, $130. So you're looking at full coverage for no out-of-pocket expenses or surprises. You're looking at least $235 a month. Okay? The Medigap policies are offered to you when you turn 65. It's called age-attained right. You have a guaranteed issue right to buy a Medigap when you first turn 65. Or if you are getting coverage through your husband or your spouse's employer or your employer, when you first start taking Part B, that's when you can buy a Medigap, okay? Because that's when you're actually using the Medicare. So Part A and B go with a Medigap policy. Or your choices are, instead of, to go with a Medicare Advantage plan. Has anybody heard of a Medicare Advantage plans or Part C? They're called Part C, okay? I'll be honest with you, in this area, we have 2 companies, actually 3, that offer Medicare Advantage plans. Why is that? I don't know. But if you were to go to Florida, if you were to go to California, they may offer 35 companies that would offer you a Medicare Advantage plan. So we are very limited in this area. Just want to let you know. Okay, so when you sign up for a Medicare Advantage plan, instead of using original Medicare, you would be getting your coverage under the umbrella of an HMO or PPO, which is you're working with an insurance company as opposed to just original Medicare. They can be PPOs, which is a preferred provider organization. It can be a PFFS, which is a private fee-for-service plan, or a HMO, Health Maintenance Organization. The cheapest Medicare Advantage plans are usually HMOs. They keep their costs down and they offer the lower cost to you because you are staying in their organization for all your doctors and your care. As long as you stay in network, you will keep your costs down lower. There are other Medicare Advantage plans. There's also those that are special needs plans, and they're also called all-inclusive care for the elderly, a PACE plan. We have one in this area. The special needs plan, I think there's a HMO for Humana that's a diabetes. And if you if you have diabetes, this special needs program caters to you some of the needs that you may need and some of the issues you may encounter. They have the doctors that are all in network, very easy access for you. So the eligibility for Medicare Advantage plans, you have to live in the plan service area. So those of you that live in Portsmouth may be offered a different plan than those in Suffolk. Okay, so it depends on where you live. If you are someone who's going to be traveling a lot and you're going to be outside of your home area, we kind of look at that and we weigh the cost versus taking a Medicare Advantage plan to original Medicare. Because like I said, original Medicare, you can go to anywhere, to any doctor that accepts it in the whole U.S. When you have a Medicare Advantage plan, you need to stay in network, okay? You are enrolled in Part A and Part B if you are in a Medicare Advantage plan, which means you are still going to pay the $104.90. You will also have a small copay, an additional amount that you would pay to the insurance for the Medicare Advantage plans. In this case, it's Optima, Humana, and there's an AARP HMO. You would pay a little extra in addition to the $104.90. When you first enroll in a Medicare Advantage plan, you can do that every year during open enrollment, okay? So if you are thinking about a Medicare Advantage plan and you're not in one right now, you're gonna have to wait until open enrollment of this year to be able to look at them and see if it might be a good fit for you, okay? So they call it Medicare Part C or Medicare Advantage plan. Why? It has advantages. You have one card and you're going to get your hospital, your doctors, and your prescriptions included by this one provider, Medicare Advantage plan, that those that cover the drugs. So you have A, B, and D all in one card or one company. Now, with the Medicare Advantage plans, they also offer more benefits. You may get a hearing benefit. You may get a dental benefit of once a year cleaning or screening, and you may get a vision benefit. And you also get a gym membership. It's either to the, it's with Silver and Fit or Silver Sneakers, if you all have heard of those. Those are offered for free when you're in a Medicare Advantage plan. So, Part D. I just went over Part C, which was a Medicare Advantage plan. If you have A and B, you also would have Part D. You would only have a standalone Part D if you have original Medicare, okay? The prescription drug coverage is offered to anyone with Parts A or B of Medicare. The enrollment periods for the prescription drug plan, or Part D, are also the same as what we reviewed for Part B, as in boy. The initial enrollment period when you first turn 65, the open enrollment October 15th through December 7th, and usually, like I said, that's when you can change or switch plans for the following year. And then you might have a special enrollment period if you still have your coverage through your employer. So the IEP, the SEP, and the AEP, it's the IEP and the SEP would refer to you if they're both the same for Part D or A and B. So when you hear open enrollment, it's for whatever you are using in Medicare, October 15th through December 7th. I had a gentleman come in to see me the other day, and he didn't know that he had to get a Part D because he wasn't on any medicines. And so he brought in this letter that he had received from the CMS stating, Margie, why am I being penalized? I didn't do anything, but they're telling me I'm going to have a penalty. And it's unfortunate, but that's the way Medicare goes. They think that if you are 65 and you're eligible for Medicare, you should be enrolled in a Part D for drugs. And if you're not, if you don't have other coverage and can show that, then they will penalize you. It's a very small penalty. It is 1% of the national base times the amount of months that you don't take Part D. Is it substantial? It can be, for 1 year, it's about $3.50 that might be tacked on to your Part D premium. But please let anyone know if they are on Medicare and don't have a Part D, they need to get on one, unless they have other coverage. So, just like the Part B, the D has they may have a yearly deductible. They have premiums just like the Part B. So if you have original Medicare A and B, you will have more than likely a premium for Part D. The lowest premium for 2015 starts at $15.70. That's the lowest, that's the Humana Walmart plan, which you've probably heard about. Now these plans differ depending on what medicines you may be taking. So if you are only on one generic medicine and your neighbor or your friend is on 10 other medicines, they're not probably going to be on the same plan you are, because we're going to try to find the best plan depending on what medicines you take, the pharmacy you use, and if you use mail order. So we take all that into account, and where you live, your zip code. So that's why everybody's different, and that's why usually not even a husband and wife may be on the same plan. So it just depends on what medicines you're taking. So you've heard of the donut hole. Okay, the donut hole. If your plan has a deductible, and when The donut hole is when we're thinking about the donut hole, we think of the full cost, not the amount that you pay when you go to the pharmacy. So let's say you're on simvastatin and you pay $3 a month for that simvastatin. When we refer to the donut hole, we're going to look at the full cost of simvastatin, which may be $30, okay? So when we talk about full costs, I say think about the retail costs. When that retail cost for you reaches $2,960, you then go into the donut hole. At that point, when you go into the donut hole, Medicare says, you know what, we need you to help us pay for these medicines. While you have reached $2,960, you're going to pay more, which is 45% of the brand name medicine, 45% of the cost of the brand name, or if it's on a generic, you're going to pay 65% of the cost of the generic drug. Now, when that reaches $4,700 for this year, you will come out of the donut hole, and at that point it's considered catastrophic coverage, and when it reaches $4,700 full cost of the medicine in any 1 year, you are then at the coverage catastrophic cap. You only pay 5% of the cost of the medicine. So it's really low at that point. Some people can go in the donut hole January and come out in February. Some people can go in October and come out in December. So it just depends on how many medicines you're on as to what your situation may be. And when you come into the office, our software, we can look and tell you exactly when you're going to go in the donut hole. That's the beauty of that. As with the Part B, the Part D is income adjusted also. So if you're one of those fortunate ones that made all that money 2 years ago, Medicare is going to charge you more for your Part D accordingly per month, and that's attached to the premium. Now, Medicare does have a savings program. It's called Extra Help or Low Income Subsidy. And if you qualify according to your income, they look at any income you may have. If you're single and your income is less than $1,458.75 a month, and if you have resources, they don't look at your car, they don't look at your house. When they refer to resources, they're looking at life insurance policies or savings and checking, real estate other than your house. If it is less than $13,400, you can qualify for extra help. And if you're married, they look at the combined income of $1,966 with a resource level of no higher than $26,860. Now, extra help with prescription drug costs goes like this. If you fall in and you're eligible in this category, Medicare will give you a credit of up to $30 a month, and that would go towards your premium for your Part D. Whether you're in a Part C or Part D, it will attach to your drug benefit, or the premium rather. And then all your medicines are either $2.65 or up to $6.35, but you're not going to have any medicines that are higher than $6.35 for any premium brand name medicine. There are some people that automatically qualify for extra help. Those are if you get Medicaid, if you get SSI, and if you get help from Medicaid paying for your Medicare premiums, you're already getting the extra help with prescriptions. Oh, okay, sorry. Okay, I'm being waved off because I'm getting a little lengthy here. I'm sorry. Medicaid, if you think you may qualify, call me if you think you have any questions. There is an eligibility. It is depending on your income and your resources. Okay. So I'm going to have to stop there and jump to is there any questions? I apologize. I got a little wordy. Does anybody have any questions? Go ahead.
I'm on Singapore for asthma,
Mm-hmm.
and I have Part D prescription herb.
Mm-hmm.
My copay for the Singapore was $52
Mhm.
something. In October, I was informed I hit the no. My copay tripled
Mm-hmm.
until January 1. Do different pharmacies have any discretion about how much I would be paying in a copay?
That's a good question. Okay, her question is this. She's on a brand name medicine called Symbicort, and she was told in October of last year she went into the donut hole, okay, because of the Symbicort. And she's asking, is there any discrepancy among the pharmacies as to what they can charge you for your copays? And I would offer this. Depending on what plan you're on, the plan itself may have a preferred pharmacy. You're on a prescription drug plan, and it may be with Cigna, it may be with Humana, but there's whatever the name of the card on your card. Okay, it's AARP. So it would depend on her pharmacy, maybe charging her more. She might want to check to see if there are any what they call in-network or preferred pharmacies that retail costs would be lower at some pharmacies. So it does depend on the pharmacy you go to and how much you're going to pay. But relatively speaking, the amount you pay would be the same on the plan what your covered charges would be, whether it be $5 or $10. That's the difference between the pharmacies. So check your plan and see what pharmacies, or if the mail order may be cheaper for you, if that's something you might want to consider. Yes, Bernita said that's, if you want to call me, that's something that we do specifically. We put in all your medicines, the dosages, when you buy them or how often you refill them, the pharmacy you go to, and I can tell you what the differences are. That's why you want to call us during open enrollment, because in theory, the only time we can change out your plan is during open enrollment, okay? I can't stress enough to you the opportunities you have during open enrollment. You may say, well, I'm fine with my plan. I don't need to change. That may be the case, but you may go along and next year you may have a $300 copay versus a $25 copay. So it just depends on the medicines. You may think everything's fine, but you won't know until you go to the pharmacy. That's why we're here as a service to you to help you through that, okay? Our phone numbers are up there. You can call us anytime at the Senior Services in Norfolk office. Bernita and Sue are going to hand out all of our contact information. We're also going to give you a bag with some goodies in it for coming today. Again, feel free to call me anytime with any other questions or concerns, some bills you may have that you're asking about that you're not, or your coverage, if you're not sure what you have, call me. I'm here anytime, and I'm really trying to reach out to all of our friends in Portsmouth. So if any of you have any opportunities you may think that I could come and speak at an event, I would be more than happy to accommodate. So if you want to call me, we can definitely work something out. Question in the back.
Lately, I've been hearing something about the generic and shock value that the generic costs are going to be for 15. Do you have any information on that?
Okay, he's asking about the generic cost for 2015, but that's all I heard.
You're hearing that the consumer is going to be shocked at the increase in cost for the generic drugs this year.
I would offer it depends Yeah, it's individually based. It depends on the generics. I would not throw that as a coverall for all generics or for all people because it depends on, again, where you live, what your medicine is, and where you're getting it filled. Now, the generics, I will tell you real quick, tiers 1 and 2, you know, they Part Ds are categorize their medicines according to tiers, and that's how you are charged. Tier 1 and 2s are always going to be cheaper. Tier 1 is usually $0, and that's the cheapest generic. Tier 2 is a little bit higher cost generic. But again, talk with your doctor. If you're not on a generic, talk to your doctor and see if there are any generic alternatives. If for some reason you have to take brand name medicines, you can call me, and if your co-pays are out of this world, or when you go into the donut hole, you can call me. I try to find other avenues to help keep your costs down, depending on what medicine it is. Go ahead. My contact information is in your bag, right there. Where is it? Is that there? 194. Okay. Right there it says Senior Services of Southeastern Virginia, the metro areas, 757-461-9481. And I'm at extension 121. When you call the main line and ask for the Portsmouth benefits counselor, you will get me. Go ahead.
I came to see you about 3 weeks ago.
Yes, you did. How'd I do?
Up to now, I haven't heard anything from the new Part D company that you put me in an application for. So meanwhile, January 1st is coming, I still need to get my medicine.
Okay, she's saying I put her, she came into the office and I helped her and I enrolled her in a new plan, and there must be a problem because she hasn't got her card and she needs her medicines. Please call me, we need to check that because there may be a discrepancy. I will check into it for you, absolutely. I'm sorry?
What if I give you a note?
Sure, give me a note.
I'll call you too.
Anybody else, any other questions, concerns? Yes, sir.
We're not residents of Portsmouth. Are there other
Benefits counselors? Yes, that's a good question. He wanted to know, are there other benefits counselors attached to different cities? And yes, I am the counselor for Virginia Beach and Portsmouth. We have 2 counselors that are assigned to Western Tidewater, which would be Isle of Wight County, Suffolk, Smithfield, any of those Western Tidewater. And in the Metro office, we also have somebody Diane is assigned to Chesapeake, the cities of Chesapeake and Norfolk. Okay. Okay, and Bernita's direct line. If you see on any of these paperwork that it says SHIP counselors, we are SHIP counselors. It stands for State Health Insurance and Program, State Health Insurance Individual, we're SHIP counselor. And Bernita's main line is the 757-222-4512. You can reach us there also, okay? Thank you all for your time. Hopefully I was helpful. I hope I didn't put more confusion into into your brains, but again, call me anytime. Thank you. Thank you guys. Have a good day.